The most commonly diagnosed cancer for men, of course, is prostate cancer, and it's estimated 1.4 million men were diagnosed with the disease in 2020, and the rates continue to advance. Well, here to guide us in creating a team to help battle that disease, Dr. David Morris and Dr. Benjamin Grimezi. Good morning.
Good morning. Good morning.
Dr. Morris, I'll begin with you. Can you tell me about your decision to partner with Dr. Grimezi and how that came into play?
Sure. I'm a community-based urologist, and the treatment changes over the last 10 years. The standard of care for men with advanced and metastatic prostate cancer has really shifted to be more of a combination approach to treating men. And with combinations of different medications, it necessitates creating a team that has different skill sets. And so when combination treatments move from standard hormone medication to hormone medication plus hormone pills, and then the most recent trials looking at hormone medications plus hormone pills such as Nubeqa and combination chemotherapy such as docetaxel, it necessitated creating a team to potentially be able to offer that. It's not a therapy that's right for every patient, so anyone would need to speak to their local care team to see if it might be an option for you. But for us to be able to even offer it, I had to outreach to a local community oncologist who could deliver that sort of chemotherapy to our patients if it was the right choice for them.
Dr. Grimezi, to talk to us a bit about not just the partnership, but using these combination therapies and how we can know as patients if it's right for us.
Yeah, I think the key is talking to your physician team about that. So what we've had to do is, because this care is fragmented in the community setting where most of our patients are seen, they're seen by providers across town from each other in different practices, a medical oncology practice and a urology practice, that what we had to do was establish a way to communicate in order to do that. So we created this virtual tumor board that we get on together once a week to talk about these complex cases where we either can think about escalating the care we give, which means providing additional treatments like chemotherapy, or in some situations, de-escalating or removing some of those aggressive treatments, because that person with prostate cancer is probably going to have a really good outcome regardless of what we do. And by doing that, we know that the patients, when they come to see either myself or the urologist I'm working with, they feel confident that those physicians are talking to each other, and that when they provide a plan and a recommendation, that plan and recommendation is actually one of the entire care team. It also gives confidence in the physician knowing that they are doing what they need to do for that patient in front of them, knowing that they can give the best quality of care locally, close to home, for that individual person. So I think the key for the patient with prostate cancer is asking their medical oncologist or their urologist that is treating them whether or not additional therapies or a recommendation from additional providers and additional specialties is right for them. And to do that, it's as simple as just asking.
And so we just need to get people to encourage to ask those questions and really ask for a care team as you have described. Dr. Moore, send our viewers to a website where they can learn more about all of this important information.
Well, there's a lot of generic cancer educational website. The American Cancer Society is just one. Obviously, there's a lot of different options, but the best option is always talking to your local providers, whether it's your general practitioner if you've not been diagnosed with a cancer. If you have been diagnosed with prostate cancer, speak to your urologist who probably did your biopsy to begin with. Ask them if you need to involve any other specialties such as radiation oncology or medical oncology. In that situation, being an advocate for your own care is important. It's what we would all want for our own family members if they were being managed for a new diagnosis of a cancer.
Thank you both so much for being with us today. Really appreciate the information.
Thank you. Thank you.
We'll be back with more local lifestyles right after this. Stay with us.